What if you were waiting in line in public and someone dropped to the ground right in front of you, or your baby or child turned blue? You're at work and one of your fellow co-workers stops breathing, or you are just relaxing at home and a relative becomes unresponsive. It is summer and you're at a pool where you see a child drowning. Ask yourself, would you know how to keep calm in the midst of these circumstances? Would you know what to do? Would your children know who to call or what steps to take if they were found alone in this situation? The American Heart Association states that 70% of Americans would feel hopeless in these situations because they are not educated in CPR, or the previous training that they had has lapsed and they do not remember the steps. The American Heart Association states that 383,000 out-of-hospital cardiac arrests occur annually, and 88% occur at home. Many victims appear healthy with no signs, symptoms, or underlying issues. Sudden cardiac arrest or heart attacks are the two conditions that would cause this situation to occur. A sudden cardiac arrest, as explained per the American Heart Association, is when electrical impulses in the heart becomes rapid or chaotic, which causes the heart to suddenly stop beating. A heart attack occurs when the blood supply to the part of the heart muscle is blocked. A heart attack may cause cardiac arrest. I explain these to you to provide an understanding of what the victim's body is experiencing during these times. The American Heart Association states that 4 out of 5 cardiac arrests happen at home. If you are faced with performing CPR, the life you are trying to save is most likely going to be that of your spouse, your partner, your child, a friend, or a family member. Failure to act in a cardiac emergency can lead to unnecessary deaths. Effective bystander CPR provided immediately at sudden cardiac arrest can double or triple a victim's chance of survival. But only 32% of cardiac arrest victims get CPR from a bystander. Sadly, less than 8% of people who suffer cardiac arrest outside of the hospital survive. The American Heart Association trains more than 12 million people in CPR annually to equip Americans with the skills they need to perform the bystander CPR. The situations can arise anywhere, at any time, and with anyone. So today, I'm going to educate you on the basic skills to resuscitate and things as a parent that we can do to help our children if they ever find themselves in this situation. To start, I found an emergency contact sheet from kidshealthorg.net website. This is something that is important to have in your home near the telephone. During an emergency, it is easy to become upset or disoriented as adults. Imagine the terror the child goes through. When making this list for your children, make sure the emergency numbers I will list shortly are written in dark colored ink or typed in large font, and each contact is spread apart so the child can easily read it. On this list, per the Mayo Clinic and American Heart Association, it should include emergency medical numbers such as 911, poison control, hospital emergency room, the fire department, the police department, your primary doctor numbers, your parents' work cell or pager numbers, neighbors or the closest relatives, and the pharmacy. As a parent, I would list these in an order that you would want to train your child to dial. I would also suggest putting on the sheet your address. Even if your child will typically know your address offhand, in moments of stress and chaos, it would be easy for them to forget. Next, we are going to start with steps to take to administer CPR. There are 2 different kinds of CPR that can be administered: hands-only CPR or cardiopulmonary resuscitation. Hands-only CPR is what the American Heart Association suggests that you use if you are not certified in standard CPR. With this, you just provide uninterrupted chest compressions of about 100 a minute until paramedics would arrive. You do not need to attempt the rescue breathing. If you are well trained, you would begin with 30 chest compressions before checking the airway and giving rescue breaths. If it is a child CPR, it's administered a little differently. You would start with performing 5 cycles of compressions and breaths on a child. This should take about 2 minutes before calling 911. You will use only one hand to perform compressions, and you would breathe more gently into the child. You will use the same compression rate as you would use on an adult, which is 30 compressions followed by 2 breaths. This is all going to be in one cycle. Following the 2 breaths, you would immediately begin the next round of compressions and breaths. I will go into more depth with 2 of these on our victims today. A thing to note is that the Heart Association uses the acronym CAB, which stands for compressions, airway, breathing. Today, I am only going to perform the hands-only CPR on our adult victim. The first thing you always want to do is assess the situation, so that you are safe as well as the victim. You want to check to see if the victim is conscious or unconscious. If they appear to be unconscious, you would tap or shake his or her shoulder and loudly ask, "Are you okay?" Just like this. "Are you okay?" If the person does not respond to you and there are two people available, one should be calling 911 while the other begins CPR. If you find yourself alone and have immediate access to a phone, you would call 911 before beginning CPR, unless you believe that the person has become unresponsive due to suffocation, such as drowning. In that scenario, you would begin CPR for 1 minute and then call 911. If an AED, which stands for Automated External Defibrillator, is immediately available, you would deliver one shock if instructed by the device, and then you would begin CPR. After assessing and confirming the victim is not breathing, for hands-only CPR, you would begin your chest compressions. You want to cross your fingers and interlock your hands. You want to push down into the center of the chest 2 inches and keep doing it. You want to pump your hands hard and fast at the rate of at least 100 per minute, faster than 1 per second. So when you do this, you also want to make sure that your shoulders are over your hands. And you would do it just like this. You would continue to do this until help arrives. Now, there are some hospitals that train chest compressions to the song "Staying Alive" by the Bee Gees, which is a step that you could also try to take just to get used to the rhythm. For child CPR, the compressions to ventilation ratio is 30 to 2. 30 chest compressions, 2 breaths. If you are alone with a child, you want to give 2 minutes worth of CPR before calling for help. You would assess the situation just the same as you would with an adult. You would make sure that everything is safe and clear for you and the victim. You would also check to see if the child is conscious or unconscious by tapping them on the shoulder and asking them if they are okay. Once you have confirmed that the child is unresponsive, you will use the heel of 1 or 2 hands. For this, I'm going to use my doll. Thank you. So for a child CPR, you would just use the heel of 1 hand. You would press in on the sternum approximately 1/3 the depth of the chest, about 2 inches. At the rate of at least 100 per minute, you will go just like this. At that point, you would tilt the child's head back, listen for any breathing. If you don't hear any air sounds, you would tilt the head back, pinch the child's nose, and put 2 gentle breaths into the mouth. You would cover the mouth with yours and blow until you see the chest rise. You would give 2 breaths. Each one should take 1 second. After you are done with that, you would continue with the 1 palm into the chest and do 30 pumps, and then you would do 2 more breaths until help arrived. Infant CPR is done a little different, and I would suggest that any parent with a child or an infant, they would go to take the steps to learn how to save their infant or child's life if need be. I hope that you walk away from this with knowledge of the steps to take and more information than you came in with. The American Red Cross, American Heart Association, and nearby hospitals are 3 places that you can contact to get more information on how to get certified. There is also all kinds of information throughout the internet to provide yourself with more knowledge on administering CPR. I use the American Heart Association website, the Mayo Clinic site, and kidshealth.org. Please see what you can do to get certified. You may be the only hope to someone who is between life and death. And remember that doing something is better than doing nothing when it comes to emergency situations like this. I hope you have a great evening. Thank you.
Good. That was your best presentation.